My name is Dr. Hilary Leeson, and I'm speaking to you now from Perth, Western Australia. We completed this quality assurance project in 2021 in the ICU at Royal Perth Hospital. The project was commenced with the aim of identifying the rate of deep vein thrombosis associated with central venous access devices in ICU patients. Of course, this is an important issue. CVADs are regularly placed in the ICU for the purpose of providing IV access, administering vaso support, and for hemodialysis in critically ill patients. But they do come with risk of complications and associated morbidity and mortality. We wanted to ensure that the rate of thrombosis within our unit was not abnormally high, and additionally identify factors which might contribute to CVAD-associated thrombus. We used an audit tool, as you can see in the bottom right of your screen, and collected data under a number of headings. 70 patients were investigated over the study period, and 77 lines were placed in total. The majority of CVADs were cited for vaso support, and most of the lines inserted were central venous catheters. The most common site for insertion was the internal jugular vein. Notably, 44% of our patients were not anticoagulated at the time of CVAD insertion. This may be related to our population. Royal Perth Hospital is the only level 1 trauma centre in the state of Western Australia, and the ICU deals with many patients following significant trauma where a contraindication to anticoagulation may often exist. We had a clinical suspicion for DVT in 4 patients. All 4 were investigated with ultrasound Doppler, and 3 of these patients had DVT associated with a CVAD confirmed. All 3 of the patients who developed DVT had multiple risk factors for DVT. They were all admitted following trauma, were not anticoagulated at the time of CVAD insertion, and had additional risk factors for thrombosis. 2 of the patients had a 5-lumen, 20 centimeters long, 9.5 French CVC, and the third one had a triple lumen, 55 centimeters, 6 French PICC line. The overall rate of 4.3% of thrombosis associated with CVAD within our small sample was at an acceptable level. We concluded that this is an important clinical issue, and that ICU specialists must always consider the risk of thrombosis versus the necessity for a CVAD. This project only collected data on a small sample size, so no statistically significant conclusions could be drawn on other factors which may have contributed to thrombosis. We would need a further larger study to ascertain this. Thank you so much for listening. Please direct any questions or comments to my email, hilary.leeson@health.wa.gov.au. Thank you.